Welcome back, everyone, to my show, NainaMD, Fusion of Science and Beauty, and I have the most fabulous guest. I'm so in awe of him because he has done so much for the transgenders, and he's the most amazing plastic surgeon that I know of, Dr. Stephen Pincus. Would you please tell the audience about? I think it's so important for people to realize that transgender have their needs. What is special about the kind of plastic surgery that you would perform, some of the procedures that you would perform for the transgenders?
Right. Well, basically what is misunderstood is that patients who are transgendered patients, it's a matter of not sexual preference, but sexual identity.
Yeah.
And these are people who are born into a situation where they feel there is a disconnect between the way that they think and what they think who they are, as well as their body.
Right.
And before there was a diagnosis of something called gender dysphoria, which basically means that you don't like your gender, these people actually thought that they were going crazy. And then eventually the diagnosis or the symptom complex evolved, and they realized that they weren't alone. There were a lot of people who had that same urgency to do something about it. We've seen patients who are very diminutive and can look like women, especially the Eurasian community. And then we've seen bigger people. I've operated on people who are 49ers and Marines, who very macho, masculine looking guys who still feel that they're women. And we do surgery to make them look more feminine. And they may never look exactly like a movie star, but as long as they're doing something in that direction, they feel that they are getting on with their life in the right direction.
Yeah. In other words, what you're saying is that it can be very devastating if there's no one to address that there's a need for them to undergo certain procedures so that they can feel like they're living, a quality of life for them, correct?
I had a patient who used to carry around a loaded gun to kill himself until he eventually made that decision to undergo the transition, and then he was at peace, finally.
Wow.
We've seen it with, recently on TV with some well-known people who have it's an urgency that they feel they have to take care of, and they can't cover it up. They can't.
They have to come out with it. In other words, they have to come out with it.
Yes, exactly.
Yeah, it comes to a point where there's like, I need to assert, and I need to get on.
Right, they can't block it anymore. It's just
what are some of the things that, for example, let's say you've got a transgender from male to female, okay? What are the things on the face, or what are you looking to do? Like, for example, I know Adam's apple can be masculine, correct? Right. But if you're going from female to male, can you create that, or what do you create in the face to give the masculine look? What is a masculine look?
From a female to a male?
What's the masculine look?
A masculine look is a stronger, more obvious facial features. Going from, let's say, above to below, there's a male pattern baldness, which a lot of men don't necessarily like, and that usually involves temporal recession. Some men even shave their head, so they're completely bald, which is considered masculine. The eyebrows are fairly straight across, right on top of the eye sockets.
So how do you do that? What procedure would you do? Because most women have, the more of a curvature. How do you create a straighter brow line?
That is actually quite difficult in terms of trying to bring the eyebrow down. You can do certain surgical maneuvers to
that's what you do. Basically, you do surgical.
Things up. Okay. Or you can actually just pluck the eyebrows and then pencil them in.
Okay. What else do you do to
well, first of all, in general, female to male transsexuals rarely come in for facial surgery. They take male hormone. And what happens is, if they're genetically programmed to lose hair, they will lose their hair, they'll have male pattern baldness, and their voice will deepen, and they'll grow a beard. So it's very rare that anyone who does facial surgery for the transgender community to operate on an FTM, a female to male.
So what's more interesting would be the opposite then.
And curiously, though the male the masculinization, the facial masculinization, is easier for a FTM. The sexual reassignment surgery for them is much more difficult.
I see.
When we go to the MTF, the male to females, it's just the opposite. There are many procedures we can do to feminize the masculine face, and the sexual reassignment surgery is much easier.
Got
When
it.
we're doing that, there are a million hair procedures that you can do, from scalp reductions, transplants, and so forth. We do brow lifts to create a higher, more arched eyebrow.
Yeah.
We can also do eyelid surgery to create a higher platform for mascara. Certainly rhinoplasty or nose job to create a more diminutive, more upturned nose.
Upturned nose. Right.
We like to create a fullness in the upper face, which can be cheek implants. Sometimes fat transfer works. And then men tend to have...
And then we can do the lip plumping, right?
Well,
the plumbing.
but even more importantly, men tend to have a longer white lip and without much of a pout or a rotation of the red. So one of the procedures that's very, very popular is to do a lip lift. We make incisions under the nose, the base of the nose, take out some tissue there, and we actually shorten the white lip and can even rotate the red lip up a little bit to create a pout and to show more teeth. Yeah. And then, of course, we can do fat transfer at the same time. And then there's all kinds of jaw surgery that we do to make it more feminine. And then shaving down the Adam's apple to create a more feminine a neck.
That's how many would you say, how many surgeries over a period? I know everyone's different, but on the average, to achieve that look, so to speak, how many surgeries on the average one patient when if they're going from
it's a difficult question. I think
female.
that most patients are certainly
and I'm sure finances are also limiting and so
and
forth.
sometimes they stage it too. They
or ideally, how many, let's say, procedures would you think of? All what you've mentioned, probably 5 or 6?
I would think so. There are certain that are a little bit more important than others. You know,
I think the eyebrow would be, right?
Eyebrow is important, and also we drill down the bone. Men have a ridge of bone here called a supraorbital ridge, and actually if you found a skull and you saw that ridge, you'd know it came from a man. So that's one of the things that we do. We drill that down, and actually if the forehead slopes backward, I build it up. I actually use something called methyl methacrylate to create a more vertical, somewhat slightly convex forehead, which is more feminine. I also make the voices higher. There's another procedure we can do to tighten the vocal cords, to shorten them, to make the voices higher. There's a whole constellation of different surgeries.
I mean, you're sort of far above the, I mean, what the norm of.
It's a specialty,
specialty
niche. I've been doing it since the mid-90s, so I was one of the first in Los Angeles.
How do people find you? I mean, what is you're in Beverly Hills, obviously, but how do people find? What's your website?
It's just my name, drstephenpincus.com.
Okay, drstephenpincus.com. Okay.
And it's interesting, but these groups, these transgendered groups, they're very close communities, and they talk amongst themselves to go to this surgeon or that surgeon if you want this done or you want that done. So they sort of know what's going on, and they share information.
So it's kind of the word of mouth is also very, very
pretty much. It's pretty popular. It's
no, I just wanted the audience to become aware that part of anti-aging and regenerative medicine is also having the right to choose your own identity and what you feel comfortable with, and to be able to know that there are surgeons and surgeries that are cutting edge that can achieve a result that can be phenomenal.
Well, of course, they're all on hormones. I mean, they are all on their respective.
Well, that's I do a lot of the hormone balancing, and also we also have electrolysis, which are very important. You know, to have that. And I had actually an amazing electrolysis come on the show, talk about that. But it's a team. It's a team effort, and that is so important. You know,
of course.
And but you took time out today to be able to come out and discuss such an important issue. Do you? That's a part of your practice. What else in your practice do you do? Do you focus more on the face, or do you focus?
I stay pretty much on the face.
Yeah.
I do all the facial reconstruction for after cancer. I do the cancer resections and the reconstructions for for a group in Torrance called Healthcare
Fabulous.
Partners. And then, of course, in my own practice in Beverly Hills, I do a lot of cosmetic surgery.
Are you partial to, if I had to ask, are you partial to fat transfer for the cheeks or filler or both? I mean, of course, each patient is different, but are you starting to incorporate more and more fat transfer? Do you see, what are your opinion on that?
I think fat transfer has its place, but once again, it is a surgical procedure. So the question is, if a person is undergoing a surgical procedure, do they want to have fat transfer, which there's some element that stays beyond the usual metabolism and loss of the fat. In other words, having cheek implants are a little bit more permanent. If a person is not interested in having a surgical procedure, they may want to go with one of the thicker fillers like Voluma, where they can get an idea of what the cheek implants would look like.
Right.
And then later on they could opt for having a cheek implant placed where it would be permanent.
What's the latest in eyebrow? Do you do the can you
endoscopic?
Endoscopic, yeah. Tell me about that.
Yeah. Well, in the last several years, there have been a lot of surgeries done through little holes in the body to avoid bigger incisions and to avoid cutting certain nerves. When we get to the forehead, the traditional way of doing a forehead lift was to make an incision basically over the top of the head, going from ear to ear, over a suture where bones form in the skull, called a coronal suture. So this was a coronal forehead lift. But unfortunately, you're cutting through a nerve, a sensory nerve that goes to the center of the forehead. So you'll be numb from that point to the center of the head, and it takes about a year or so for that to come back. Sometimes you get some itching and some weird sensations even persist beyond the ear.
And now you can go
and
into
also
an
you have an
endoscopy.
incision that sometimes shows if you're swimming. So we make these little cuts and we lift everything up, and then we free everything, and we actually just move the scalp back, and then we fix it in place so that everything is rotated posteriorly, fixed in place, and then it just settles in that new higher level.
Yeah, it's amazing. That eyebrow, I think, is one of the most amazing procedures. You see results almost. It's like an instant gratification. Yeah. I've seen that. Right. Is that part of the endoscopic brow lift then?
Well, that is an endoscopic brow lift. Now, many male to female transsexuals will have that bony ridge reduced at the same time.
Got it.
Now, since we have to do that, I've done it once through those little holes. It's very, very challenging. So for the most part, we do a coronal incision for that, so we can rotate everything down, see the bones, drill it, and then if I have to build up the forehead, we use this methyl methacrylate at the same time. And then when we're pulling the skin back, we can create the arch that we want at that time. Great.
So this is, I mean, you have to see, or I think anyone who's considering a brow lift absolutely has to come to you. So again, it's drstephenpincus.com.
Right.
And thank you so much for coming to the show and just making the audience aware of what's available now. And I'm going to bring you back. You just don't know that. Thanks again. Thank you so much.
Thank you.
Thank you, everyone. This is the conclusion of my show. We'll see you next week. NainaMD, Fusion of Science and Beauty.